this point now, thank you everyone for joining us today on this Thursday, the 28th. My goal today is to make sure that everyone on this call understands the process of the county vaccine sign up for schools and some of the details that go into all of that. And if you hear background noise from my kids, I apologize. They are at home today with me, and they're 11 and 9-year-olds do fight over things. So I'll try to get them to quiet down a little bit. Let me pull up the Pima County website here first. Okay, so for folks on the call, if you haven't already gotten an email, which I'll talk about this in a little bit more detail, from TMC MyChart, then your direction for now is to go to the Pima County website and register to start to receive your vaccine. So I'm gonna talk you through this, and I'm gonna talk about some upcoming changes you're gonna see on the language on this website too. If you go to pima.gov and then you click this receive your vaccine shot right in the banner, you can also go down here in the tabs and click COVID vaccine. Once you click this, it's going to take you to our vaccine page, and then you'll see a button right here. And just to make sure before I proceed any further, is everyone seeing this? Miss Early, if you could just give me a thumbs up if you're seeing this, because I have a visual on you. Perfect. All right. You'll see registration for priority phase 1B, this button right here. When you click that, it's going to take you over to this page, and then you'll see school and childcare workers right here. When you click this link, these FAQs are going to be super helpful to address a ton of the questions that I've been getting in. Things like, how do I schedule my second dose appointment? Why do we get it too busy? Why doesn't the schedule go out very far? Like I have been inundated with emails since yesterday. I think I had about 250 in my inbox since this went live last night. And almost all of those questions can be addressed in these FAQs. So please make sure to direct staff here. This button right here, there's been some confusion about this too. And the understanding, and this is clearly a county public health communications issue. When this first launched, this said the same thing as the other buttons here, make your appointment. Any one of these buttons puts you into a system for RegCap, okay? Any one of these buttons, it's all the same thing. It's all gonna direct you to the same RegCap system. But we're not gonna use that term RegCap, we're gonna say Pima County registration, all right? So I just want to be clear on that part. Once you click this button, it's going to take you through a survey, and then that survey goes into that RegCap database, which the county pulls every couple of days, and then we use that to send over massive files to TMC MyChart, and that puts all of those individuals into a queue or a line for distribution for MyChart emails. So one of the big questions that we got is, why haven't my priority staff received emails yet? And I promise you I will address that by the end of this session within the next 10 minutes. So just hang with me for a bit. The changes you're going to see potentially today or tomorrow are the wording on these buttons, because we recognize that by saying pre-register for your appointment here and this note down here at the bottom for education, that clearly creates some kind of understanding amongst the education community that our K through 12 are not being prioritized. So that again is a communications error on our part, and we are working. That was brought to our attention today. We are going to fix that. I asked that this button get changed last night when I got slammed with all those emails, because I had a bunch of people emailing me and saying, hey, I clicked the button, I registered, I'm still not getting an email. And again, I'll talk about that process. This video will be available for all your staff to see, and hopefully there'll be some clearer communications about this overall process. So I wanted to walk you all through this. Again, make sure that you all know that these FAQs will answer the vast majority of the questions that your staff are posing to your HR about this registration process and how it works. So please use this resource as much as you possibly can and defer to this for your staff, okay? I'm going to bring you over really quick to a overview of what this process looks like. And again, you'll have to forgive me. I built this morning to try to anticipate the needs of the questions that we're going to come through this meeting, and in order to communicate more clearly how this whole thing works. So all of the districts and all of the private and charter schools had submitted an Excel spreadsheet with their priority staff over to me directly, which then I put into a giant Excel format and sent over to our Pima County IT team, who then scrubbed that data, put it into a compressed file, and then sent it over to TMC MyChart. So after I get those Excel files, I make sure that they're formatted correctly, and then I sent them over to IT team. IT team then applies a whole load of coding in order to ensure that the formatting is appropriate for TMC to send out the MyChart emails. So then that massive file gets dropped off with TMC. As of last Wednesday, there were 13,858 people with the combinations of all those Excel files that got dropped to TMC. TMC was able to accept about 12,000 of those. So that's about 1,000 some that were not accepted into the TMC file format that got dropped off, which is one of the reasons why we put that. If you don't get it by Wednesday at 5, go ahead and register through REDCap, and I'll loop back on that in a second here. So that entire group of 12,000 people was added to a queue in the TMC system for MyChart. Now, we can't send out a big batch email to all 12,000 of those people in one go, because we need to schedule out the vaccines appropriately as those doses come in. And we have a very short window between when the state says you're going to get this much for us to approve that and go through. So if we were to schedule 2 weeks in advance, and again, this is addressed in the FAQs on that page I posted earlier, if we were to schedule that out 2-3 weeks in advance, it could cause some serious issues. So TMC daily right now is sending out about 2,000 MyChart invitations from this group of 12,000. So if your staff was submitted earlier on this Excel spreadsheet, I'm going to zoom back out here again so we can get a complete view of the process, and we'll zoom back in on again. If your staff was submitted on this original Excel spreadsheet, they were added to this queue. However, we do know that there was 1,000 and change that were dropped from this system, and we do want to make sure that those folks get vaccinated. So we asked them to go to that county website and hit that registration button to get added back into this queue. Now, I want to use a specific example here. Let's say that Jane Doe was on the list, and since I see Dr. Valenzuela there, I'm gonna pick on his district a little bit. Jane Doe from Sahuarita was on that list and was submitted over to TMC. And in this queue of 12,000, Jane Doe is number 958. Okay, Jane Doe still didn't receive the email from MyChart Wednesday at 5. So Jane Doe went to the Pima County website and did the survey to enter into the REDCap system. Jane Doe gets added to this list and will get dropped back over to TMC again, and we'll end up with 2 places in line here. She'll have place number 900 and whatever it is, and then place, let's say 16,000 as well. We do a scrub to make sure that we're eliminating duplicates. So the only duplicate that will get eliminated is the last place in line. So Jane Doe will maintain her place for number 957, and we'll say that that specific group is going to be emailed out MyChart on Monday of next week. So she maintains that place, and then the last place that she took is eliminated from the system. So it's really challenging to try to communicate this entire process with short notice and to do it in a way that makes sense to all of you. I think it's easy for me to kind of think and comprehend and understand it, which is why I'm taking this attempt to try and explain all of this, because again, I know that it's caused a lot of panic and confusion. What we want to assure our teachers is they will receive a MyChart email if they were on that priority list, unless they were one of the 1,000 and change that was dropped. If they were one of that group, we can't identify who those folks are, because the entry fields were something like the first name was a question mark or the letter K or L or something like that. So we have no way to identify who those folks actually were, which is why we asked them to go back into the system and pre-register to get back into the queue for the MyChart email. So I hope this is making a little bit more sense at this point in time. And I'm going to zoom back in on this part of the process to maybe give us all a more comprehensive understanding. And by the way, if any of you have any ideas on how to more clearly communicate this in condensed ways, please, by all means, send them over to me, and my team, and we will work to get that message pushed out. So again, there's about 2,000 from this 12,000 group that are going to be pulled daily and going to be sent out this email from TMC MyChart. So if your staff haven't gotten it yet, don't worry, they'll get it. If they're anywhere in this system, and they only have to register through the county once, and then they'll be added to that queue. Any subsequent registration will just create a duplicate in the system and then pull out that last registration. Once they get that email from TMC MyChart, that's when they'll be directed to the MyChart to correct their chart and actually schedule to receive their vaccine. Okay. All right. So I think I did that. What I'm hoping I can do really quick is if you can just give me maybe like 10 of you in the chat on a scale of 1 to 10, how well I achieved my objective today of explaining this process. 1 being like, you did horrible, Brian. This is a really, really unclear. And 10 being like, I totally got this. I could explain this in a meeting. Just a few of you drop in the chat there, 1 through 10. Okay. And Elena, that thank you for your interest email was an additional thing that just started happening today. The email that I'm referring to is the email from TMC MyChart. Okay. Oh, this is so good. Thank you all. This is my check for understanding for all us educators out there. So it tells me that I have achieved my learning objective today, which was to make the process understood across the aisle here. All right. So this video that we're recording today is going to be published on the YouTube channel. Tiffany will send a link out to this email list so that you can share this out with staff. Again, if any of you have any ideas on how to condense all of this information into an abbreviated format that's really easy for staff to understand on the ground, we are all ears and we're more than willing to work with you all on that, because this kind of process is really difficult to explain as a whole, because there's so many partners and so many moving parts in line. I do want to give a brief couple of updates. So yesterday at the U of A pod vaccinated 812 K through 12 educators. That's 12 over the 800 amount. Everyone is being scheduled, and that schedule filled up within 2 hours of us opening up this overall process. So that tells us that this is actually working the way that we wanted it to work. No more midnight shifts for Brian, which is really good. We're stoked that, and we think that we're going to be able to get through a large amount of this 12,000 population in a fairly reasonable time. We have a couple of other things on the table which we're discussing, which just keep posted on the county webpage, keep posted on this webinar. We'll be announcing those things more formally. One of the things to look for next week is updated guidance. We'll be doing a release on that. I'm supposed to be filming that updated guidance on Tuesday. We're about 90% sure that we can fully support a K through 5, or K through 6 in some cases if you're a K through 6 school, hybrid thumbs up at your school district. It's really important though to take into consideration that there are some local data sets that are really critical to consider. Certain zip codes have higher proportionality of multi-generational housing, for example, or other zip codes where we know minorities have been impacted really heavily by COVID, disproportionately from the general population. Those considerations are really important to look at. And in short, what that means is that we're going to support your school board's decisions for what they want to do. And we will do a better job at doing that on a localized basis. When we first started giving some of this guidance in terms of the hybrid and remote situation, we thought that the application of a county-wide approach, one piece of guidance for a full entire county, was a good way to go. And we're seeing as we get deeper into the weeds at this that there are communities that are disproportionately affected by COVID. So those are all things that we have to take into consideration that are really formulating this emerging guidance that's going to come out next week. So that's about as much as I can give you right now on that. I know that we will be giving some more guidance before that comes out on a meeting with school leadership, district leadership. Drs. Garcia and Dr. Cullen will be providing that. So we'll have enough of a heads up before that guidance actually comes out as it continues to be finalized. Okay. I'm going to head over to the chat. Can you repost the name given last week for PCHD contact who is coordinating RNs who would like to volunteer? Yes. So you're going to email eocvolunteer@pima.gov. I'm going to post that in the chat here. All right. So email that group right there. And then those folks will be redirected to move over to ESAR VIP, which is our AZ ESAR VIP, our early registration system for advanced healthcare volunteer health professionals, something like that. So yeah, look for that. Yvonne, email from PCHD about confirmation of your interest in COVID vaccine. We're still waiting on TMC. Yep. So Yvonne, that just means that you've been added to the queue, and that as soon as it's your turn, TMC will drop you that email and that ping to get you on that schedule. Okay. Great question here from Nicole. How or when is the second shot scheduled? So this has been a interesting piece to navigate through. If you received your vaccine on that first week, Tuesday through Thursday, when I was manually scheduling all of those, we have to go back and manually upload all of those accounts into the TMC system. So the overall response for that is TMC MyChart will send you an email for your second vaccination. So just keep a lookout for that. It could take up to 10 days. It'll be before the 21 date mark for the Pfizer if that's the vaccination that you received. But you will receive that email from TMC MyChart if you're looking for that second dose. If you have access to MyChart, you could potentially have the option to log in and self-register for your second shot. So just keep monitoring that. They have to make sure that they get all of the information from all the folks who went down and registered on site during that week 1, as well as any walk-ups that came through the TCC system last week as well. Okay. And this week there was some walk-ups. While we're on that note, I do want to talk briefly about TCC. The scheduling window is now activated for that site as well. It's going to be really difficult to do a walk-up at that site. So just keep posted for guidance around that too. We know that we got a lot of teachers vaccinated, K through 12 at the TCC. The intention of that site was primarily for law enforcement. But I think we're reevaluating that assessment right now of what that site is going to look like and how that's going to work. And we'll get some guidance out to all of you before next week around what that looks like. Okay. K through 6 thumbs up, also going to have a 2-week window, or is it good to go? I'm not entirely sure, Miss Cool. Maybe you can unmute and help clarify that question a little bit. So let me just talk a little bit about what that guidance is really going to entail for the K through 6 and K through 5, if that's the case. The really, really important thing for you to do is to mitigate. All right. So that means that absolute masks wearing in your building, that you've got the social distancing down really, really hard, that you're limiting the number of kids in a classroom to where you're able to maintain effective social distancing. I can't give you a direct number on how many that is for your classroom. It's going to depend on your own class size, but having that 6 feet distance from student to student with really being strong in adherence to that mitigating factor is going to be a critical piece of that recommendation that we issue next week. So just make sure that the masks and the social distancing are really implemented very stringently, and that the washing is also occurring, washing of hands, washing of frequently touched surfaces. So you'll hear all of that, and emphasis on that next week. We did see reports from the CDC just released this week, as well as the weekly mortality morbidity report that came out that supports that same stance, that schools overall seem to be safer places for the community, but that is coupled with really strong mitigation, and we cannot emphasize that enough. Question from Riz Steinley, is there genomic testing occurring in Pima, Arizona to determine what strains are prevalent and if we have any of the variants? Actually, you know who might be able to answer that question is our great colleague from the U of A, Dr. Lynn Gerald. If you're on right now, are you able to answer that question for me?
I'm sorry, it took me a minute to find the unmute button. I think there are some folks looking at that, but I think Yanko here at the university is looking at that, but I don't know that we have much data yet. But I'll try and look into that and let Brian know so he can get back to you.
Awesome. Thank you. Great question, Miss Steinle. I just got to give Miss Steinle a high five here because every session she gives me some really good stuff to think about, and I really appreciate that. Yeah, awesome person. Worked with her for a while too. Dr. Valenzuela, okay. So we know that there was about 1,000 and change that got dropped from that district Excel sheet that of the 13,000 plus that got sent over. Again, we don't know who those folks are. So we want to absolutely ensure that all of those folks make it into our system somehow. And we don't have a way to cross check that currently. Once that batch gets sent over, they just get dropped into a queue. So they don't have to re-register. The vast majority of them are going to get captured. But let's say that there's like even 1% of those folks that you submitted over that didn't get it onto that queue list, right? We have to find a way to make sure that those folks get vaccinated, which is why we're saying go ahead and go through the county system as well to register. And that's part of the communications piece that I've had really a lot of trouble trying to figure out how to communicate that effectively. Because we are prioritizing our teachers. We set aside one site completely for K through 12 for 2 weeks straight. We're opening up other sites for K through 12. We're upping allocations. So it's just the perception and frankly the way that I asked for it to be worded on the website is definitely causing some of that perception. So I can take responsibility for that for sure. Does that answer your question, sir? All right, thank you. Yay or nay as far as taking ibuprofen? Ooh, I don't know. Sorry. I'll see if I can get back to that question here in a minute. Oh, gotcha, Miss Cool. When you said distant, you gave us a 2-week warning. Oh, I understand now. Apologies. All right, thank you, Miss Cool, for the clarification on that. So it's been really difficult to give timely warnings or timely advance notice for our districts when it comes to COVID because we find that situations change so rapidly. And again, the CDC and MMWR guidance literally just came out this week. So we're trying to play catch up a little bit with some of that guidance. You're more than advised to take 2 weeks to get that transition solid for your district or for your school site if that's what's needed. But when that statement comes out next week, we're still literally drafting it right now in this point in time. So just keep an eye out for that, okay? Yes, and Ms. Whitesize redirects you to Medical Reserve Corps of Southern Arizona. We've had some issues with MRCSA. They've been I have been told on a meeting yesterday that those issues are being addressed and resolved. So just be a little bit patient with that volunteer system, and continue to go through those channels. Okay. Question about double masks as we return to in person. Any recommendations? I don't at this point in time. I do know that at the U of A pod site for walk-ups, we were asking anyone with a cloth mask to couple that with a surgical mask underneath. But I will get back to you on that question, Ms. Wissinger. Tiffany, or Becca, if you can maybe just copy that question and paste it in with some of those other pieces, are the other questions that we need to make sure we address. You are not being a pain, Ms. Steinle. You are one of my favorite nurses. CDC says yes on ibuprofen. Thank you, Ms. Early. Follow CDC guidance. And, oh, hold on. Ms. Gerald, no to ibuprofen, Dr. Gerald, before the vaccination. There you go. Okay, so make sure you take that piece into consideration there, and we will make sure we get that guidance typed out. Dr. Gerald, thank you for adding in on that. So Ms. Early, please cross-check that with what Dr. Gerald is saying there.
Brian, this is Lynn. There's Dr. Gerald, either way. But there's a lot of information in the public, and particularly on social media, going around telling people to dose up on medication before they take their vaccination. So I think that's what people are hearing. But no to dosing up on medication before. But if you get symptoms after and don't feel good, then of course you can take it. But there's
all right.
there's a little bit of evidence that shows that it could interfere with your ability to react to the vaccine. So that's the reason they're just saying, don't take it before.
Nice. Thank you for that. I appreciate that. So, and we'll make sure, we'll look at getting some guidance, some real clear guidance on that out to the folks on this call too, through either a visual or some kind of communication. Shai, there's so many favorites. It's like Santa Claus. What happens if staff decline the MyChart invitation but still want the vaccine, or if they miss the 24-hour window to respond? They will get a re-invite. So that 24-hour window, you'll see the how that's addressed in the FAQs on the website. Effectively, when there was a batch of 8,000 that were dropped last week, and there was a load of errors on that managed to make it through. TMC had to recall a lot of those 8,000 folks, which is why that 24-hour window came into play. So they'll either be able to continue to activate their MyChart later, or once TMC is able to address those errors, that's when that'll be taken care of. Okay. And again, go back and check the FAQs on that page, because I think that one in particular is addressed there. And yes, Ms. Waldron, absolutely, medication with vaccine. And I don't know about Tylenol as well. That's something we can investigate. I don't know, Dr. Gerald, if you've got any insight on that.
I think the same thing is, don't take any over-the-counter medications beforehand, unless, if you're on over-the-counter from your physician, you should talk to them. But the basic recommendation is not to take anything beforehand. But of course, if you feel poorly after, then you can take anything to address your symptoms.
Awesome. Okay. I did it. I got everything done before 11:30 here. And I will give a couple of seconds here for a couple questions to be addressed. Yes, Ms. Escobar, they're not going to miss out on the vaccine. Again, that was one of the that's the exact error that we were talking about with the 8,000 invitations that went out that had to get recalled. The error was that there was other people were receiving names that were incorrect. Shared last names was the big issue with that. When we ran our first test scrub on all of that, it created some errors that we didn't find out about until a colleague of mine called me and said, hey, this is a problem. And then, yeah, that was an issue. Second shot, I'll repeat that. The second shot, wait for an email from TMC MyChart. Give about 10 days or so for that to come through, okay? Yeah, Matt Stamp, thank you for that. If you've gotten your vaccination, or if you are in line to get your vaccination, grab a selfie and send that over to Matthew.stamp@pima.gov. Dustin's office has been doing a great job. Superintendent Williams' office has been doing a great job on getting that published and out there. Celebrate it with your school districts. Like, all those things are really important. Oh, I see what you're seeing, Peggy. Apologies. Let me see if I can get someone on here to help out with that. Go through attendee list here. I think, oh man, I think our vaccine experts are probably slammed right now, because I'm not seeing any of them on here at this point. We are going to have to table that for a future agenda item, because I feel really uncomfortable giving any recommendations on that, being that I'm not a medical professional in the field, and I'm not up to date with all that current vaccine content knowledge. Dr. Gerald, if you have any insight as to the vaccine window, get your first dose, and then you develop symptoms, test positive, do you need to wait to receive the second dose of either Moderna or Pfizer?
Yeah, I think I won't comment on that either, since I don't know the official health department answer.
Okay, cool. Thank you. Maricela, this is part of that follow-up communication. So share this YouTube video. I'm going to actually stop recording right now.